So thanks to Hear Clear, our partner for today, for bringing this topic about hearing health in older adults. And from Hear Clear, we have Dr. Isheeta, who's here with us, joining us live from Delhi. Welcome and good evening, Dr. Isheeta. So Dr. Isheeta Verma is an audiologist with Hear Clear India, and she's currently the head of audiology at Hear Clear Clinic in Delhi's Greater Kailash 2. And over to you, Dr. Isheeta.
Hello, good evening, everyone. So the introduction part is already done by Ms. Chitra. Thank you so much for the introduction, Chitra. So today we are going to discuss about the latest advancement in hearing aids technology, and throughout this PPT we will talk about the age-related hearing issues, their impact, and the strategies in treatment options that are available to improve hearing health as we grow older. So in this slides we are going to discuss about what is hearing and how our body hears different sounds, how we can detect the hearing loss, what are the options to treat hearing loss, and what happens if you ignore your hearing loss. Next, then how to protect your earring. So we will start with why hearing is important. So hearing is important so that we can connect us with our family, our friends, we can hear the music as of our choice, we can hear the environmental sound. So moreover, we can connect with the society. So it is very important for us to connect with the society. And apart from the society connection, it is very important for our the personal safety as well as environmental awareness. Personal safety, suppose imagine if you're driving, you're walking in a traffic area and some honking sound is there and you're not able to hear the sound, that can lead to accident, right? So for personal safety it is very important that you should hear properly. The same with environmental awareness, you should take your phone calls, you should know doorbell is ringing, that alarm and smoke detector sound is there. So for environmental awareness, the sound is, the hearing is very important. So now we will move how we will hear. So basically our ear has three parts: outer ear, middle ear, and the inner ear. So this, the sound travels to outer ear, then it will transfer to the middle ear. Middle ear has two parts, that is eardrum and then this bones, middle ear bones. They will transfer those sounds to the inner ear, and that inner ear transfer those sounds to the brain through the nerve. So this is the whole process through how we can hear. We'll move to the next part. This is what is hearing loss. Hearing loss means difficulty in hearing. So some of the patients are born with it and other might get it later. Some hearing losses are temporary and some are permanent. We will discuss in detail what are those permanent hearing loss and what are the temporary hearing loss. So now we'll see how common is hearing loss. So 6 crore Indian having hearing loss, and 1 out of 3 elders above 65 years of age have sensory neural hearing loss worldwide. And 47% of untreated hearing loss were found to have symptoms of depression. We will see why those untreated hearing loss can cause to depression, can lead to depression. So these are the types of hearing loss. One is unilateral, another one is bilateral. Unilateral hearing loss means hearing loss in one ear, whereas bilateral means the loss in both of them, which is very common in elderly age people. Because as our age is increasing, so our nerves is also getting weaker day by day. So again, there are two types of hearing loss: conductive and sensory neural. A conductive hearing loss, which is caused by whether there is some blockage to the wax, any middle ear infection, or something stuck inside your ear, or is there any hole inside your eardrum, that can cause to conductive hearing loss. So if you have any conductive hearing loss, then there is some medication or the surgery is required. So, and you have any sensory neural hearing loss, so it can caused by damage to inner ear or the pathways to the brain. So sensory neural hearing loss can occur before or after birth. So how it happens, we will discuss again in details. So what it is, this is an audiogram. So this is a visual representation of an audiogram, you can see that this is a horizontal axis, a vertical axis. In horizontal axis, you can see that these are the frequencies. You can see that 125, 250, 500, like we know a human body can hear 220 hertz to 20 kilohertz that frequency. But what are speech frequencies like? They start from 250 hertz to 4000 hertz. So these horizontal axis here frequencies are coded. You can see that on the left corner, the low frequencies are there, and the right corner of the audiogram, there are high frequencies. As you can see that vertical axis. So basically this represents loudness or volume of the sound. Now you can see that. So these are the soft sound, like this water droplet sounds or the bird chirping sound. These are the soft sound. You can see that these are the intensities. So these are the soft sound. In the top of the audiogram, there will be the louder sounds. So female voice is considered as a high frequency voice. So suppose who is having hearing loss in the high frequency, those are not able to hear the high frequency sounds, right? So again, I'll explain these to you in details in next few slides. So how we will detect the hearing loss? So hearing loss is detected by pure tone audiometry test, and this test can be done in clinical setup or in the home environment also. This is a audiogram. You can see that it is a normal person audiogram. The normal hearing lies from 0 to 15 decibel. Like you can see that. This round red circle represent the right ear and this blue cross represent the left ear. So this is a normal hearing audiogram. And these are the degrees of hearing loss. Like if a 0 to 15 decibel, if we consider is a normal hearing. If a person has 20 to 40 dB hearing sensitivity, then we will consider as a slight or mild hearing. And if it is 50 to 60, then we will consider as a moderate. Again, 60 to 80, it will consider as severe. And if it is more than 90, it will consider as profound hearing loss. So you can see that a normal person can hear all of those sounds, like a tap, a water droplet sound, birds chirping. If you have a mild hearing loss, a slight hearing loss, you are able to miss this alarming sounds or this phone bell. These sounds you can miss those sounds. If you're having moderate hearing loss, then a group conversation will be majorly missing. In the severe hearing loss, the same way these kinds of sound you can miss. But whereas in profound hearing loss, like the loss, it is more than 90 dB, then you are only able to hear on the loud sounds, not able to hear these kinds of sound. So these are the degrees of hearing loss. So here I'm going to play a video. Just watch it carefully because this video is really very interesting. Just watch it carefully.
Does this video have audio or is it just visuals?
No, it is only visual.
Okay.
So all of you have seen the video. So can anybody just explain me this video? Just unmute yourself and please explain me the video.
Yeah, the man thought the lady has the problem, but he himself had the problem, which he didn't know.
Yes, you're right. Absolutely right. So the problem may not be with the other one, as we always think it could be within us. So that's why it is very important to detect the hearing loss, right? We'll move further. So these are the signs of hearing loss. People around you seem to mumble. You often ask others to repeat. You can hear but cannot understand. You'll complain, yes, I am able to hear, but they're not able to understand what somebody is trying to talk. So these are the signs that uh, people who has hearing loss, they are the signs. So they have a difficulty in following the conversation when background sound, or they are in a group conversation. They will increase the volume of TV or radio. They cannot hear high pitched sound like doorbell sound, birds. These sounds are missing. So these are the sign of hearing loss. So now tinnitus. Tinnitus is a symptom actually. So tinnitus is majorly caused by hearing loss. What is tinnitus? It is a buzzing sound in ear. So why tinnitus is there? Why it is happening? Most of us are just ignoring the tinnitus. It is mostly disturbing in the night time. Why it is disturbing? Why it is happening? We should know about the tinnitus. Why we are ignoring this? So tinnitus has multiple causes. Major cause is hearing loss, noise trauma, ototoxic drugs. Like some of the drugs are not good for ears and which we are taking, so that can cause to tinnitus. But tinnitus has treatment also. There are different treatments that are available for tinnitus: that tinnitus masking, tinnitus retraining therapy, cognitive behavioral therapy, or tinnitus therapy using amplification devices. Like there are certain devices through that we can give tinnitus therapy so that we can reduce the extent of tinnitus. Yes, it can treatable. So we have already seen that dementia, like dementia is memory loss. It is very common in elderly people. So the adults who has mild hearing loss 2 times more likely to develop dementia, and adults who has moderate hearing loss, it's 3 times more. Adults with severe loss, they has 5 times more likely to develop. And if dementia is there, it can lead to social isolation, which is with the several risk factors of dementia. Like it can cause depression, it can cause anxiety and distress also. So if the symptom, these kind of signs and symptoms are present, then what next we need to do? What your doctor, what your audiologist will do? So firstly, ear examination they will do. So through ear examination, through otoscope only, they will do the ear examination. For that ear examination, they will just check whether some wax is there, some injury, infection is there. If some wax is there, some injury, infection is there, you'll directly go to an ENT doctor and they will give you the medicine or whatever it is required. Whatever treatment is required, they will help you on that. Then secondly, after otoscopic examination, there is another test that we call pure tone audiometry test. As we have already seen that report that we call audiogram. So in this test, like audiometry test, what we are doing, we're just checking the hearing capability of a person. It can be done in the soundproof room also. Like what we're doing, we're just putting some headphones on over the ear. We'll ask the person to respond for a sound, and if he hear the sound, he has to raise the finger. So this how pure tone audiometry testing has been done. So now what is the treatment of hearing loss? So there are different treatments for hearing loss, like treating ear infection first. If any ear infection is there, wax blockage here that can cause hearing loss, so you'll go to an ENT doctor, they will give you the medicines. And other than that, we have seen that sensory neural hearing loss, it is because of the nerve weakness, or you can see that damage in the inner ear. So we will give amplification devices, that is hearing aid. If the person is not getting any benefit with the amplification devices or the hearing aids, then we will ask them to go for cochlear implant. So now we'll see what is hearing aid. A hearing aid is nothing. It's a small electronic device that one can wear behind the ear or inside the ear for sound amplification. How does it look? Let's see. So hearing aid has 3 basic parts: microphone, amplifier, and speaker. You can see that this is microphone, this is amplifier, and the speaker. This is one of the hearing aid. Any other hearing aids, we will show it later. So what basically hearing aid is specs for your ear. As we are wearing the specs, we can able to see. The same way you're wearing the hearing aid, you are able to hear. So hearing aid is for everyone. Yes, hearing aid is for everyone. So these are the varieties. These are the different types of hearing aid, that is invisible in canal, CIC, ITC. It depends on the hearing loss. Only your audiologist can prescribe your hearing aid. So basically, you can see that mild to moderate severe hearing loss. If your hearing range comes from 30 to 60% of the hearing loss, you can go for these kinds of hearing loss. So it depends on your hearing ability. Your audiologist will prescribe you the hearing aid. Next types of hearing loss hearing aids are, see, receiver in canal. This is slim RIC. Then the third one is PTE. So it depends on your hearing loss. Your audiologist will prescribe this. This will cover like mild to severe hearing loss. This RIC behind the ear can cover your 90% hearing loss. So even if you don't have a hearing loss, it is important to protect your hearing. And there is one easy tip to protect your hearing. Suppose if someone's sitting next to you, you can hear the music. So it means it is too loud. You need to just slow down the volume, right? So these are the tips, like do not neglect earaches or ear discharge. If you have this problem, just go to your doctor. He will give you some medicine and it will get resolved. Do not use sharp object to clean your ear. Avoid loud sounds. Do not use earbud to clean your ear. Prevent ear infection. Take good care of the health during pregnancy, as it can cause hearing loss to your child also. So early identification helps. Why it can help? So above age 50, compulsory general checkup is very important. So including hearing tests. So if age-related loss found, so early rehabilitation with hearing aid can be done. And the outcome will be very good actually. So what could be the possible impact of untreated hearing loss? Can anybody tell me what could be the impact for untreated hearing loss? What do you think?
Accident?
Yes. Any other? Anyone else?
Depression. Dementia.
Yes.
Yeah, dementia, depression.
Yes.
Socially, I think you will feel disconnected. You can't
Correct. You
know
will
what the other person is talking or people are saying.
Correct. 100%. Okay. So these are the reactions to untreated hearing loss, like anxiety, emotional detachment, isolation, depression. So this can cause untreated hearing loss caused by untreated hearing loss. So hearing loss can impact your mental health also. If hearing loss is there, your speech perception will be compromised. You have a difficulty in communication, your social engagement is reduced. If you have difficulty in hearing, you won't ask to people, can you please repeat it again and again? You will just isolate yourself, which can lead to depression, anxiety, and you are not going to communicate with your people, even that is your family member also. So that can affect your cognition, poorer physical function, and worse quality of life.
हाँ जी
जैसे सिर में दर्द होना, सिर में झंझनाट होना, रात में जैसे मेरा नींद खुल जाना है तो सोने के लिए मुश्किल होना मेरे को। तो जैसे अब यहाँ के आपके साथ से मैंने ये जो मशीन के लिए बात किया, आपने ये मशीन दिया मेरे को, ये लगाने से मेरे को बहुत फायदा हो रखा है। सिर का झंझनाट भी नहीं है, दर्द भी नहीं है, सुनाई में भी थोड़ा अच्छा ही लग रहा है दिन पर दिन। बस यही चीज है।
ठीक है, तो मशीन लगा के आपको फायदा मिल रहा है। जो कान में जो आवाज हो रही थी वो भी खत्म हो गया, आपको नींद आना अभी अच्छे से नींद भी आ पा रहा है और सुनने में भी आसान हो रहा है। ठीक है, आप कुछ बोलना चाहोगे कि
ठीक है,
अभी आपको कैसा लग रहा है इनके साथ बात करके?
मेरे मिसेज से आपने सुना होगा, ये बिल्कुल हकीकत है और इनको मैंने लेके आया यहाँ दिखाने के लिए। तो मैंने फिर यहाँ डॉक्टर साहब ने बताया कि ये मशीन लगाना है, मतलब कि ईयर के लिए और हियरिंग के लिए। तो वो लगाने के बाद, हियरिंग लगाने के बाद बहुत अच्छा होगा मेरे मिसेस को। तो मैं बहुत खुश हूँ। डॉक्टर साहब को मतलब कि मैं धन्यवाद देना चाहता हूँ।
थैंक यू।
Next video.
Now you are going to tell about how you are finding.
Rita, I'm now satisfied. I was concerned at first, but since you've taken all this trouble and given me this detailed test and adjustment, I'm very happy with it now. Thank you.
Thank you, ma'am.
So you have
You're-
seen the video. So this was the experience with the hearing aid. So now it is a quiz time. Here I'm going to present some statements. You guys have to tell me whether it is a myth or it is a fact. Are you ready for it? Okay, we're going to start. So if you can hear, you don't have hearing loss. So please unmute yourself and tell me whether it is a fact or myth. Anybody?
Yeah, both are correct. You can't really say hear means everything, or hearing loss means you can hear something or you can't hear something, like that.
So according to you, is a myth or fact?
It's a myth.
It's a myth. Yes,
Myth.
it is a myth. Yes, you are absolutely right. It is a myth. I have already shown you the audiogram, right? You have a high frequency as well as low frequency. If your low frequencies are in a normal range, so you can't find out, yes, you are able to, you have any difficulty. But if your high frequencies are going down, so might be few of the sound, few of the words are get missing out. So because of thing, you can hear, but it doesn't mean you don't have hearing loss. So that's why it is myth. Okay, so we'll go to next. Hearing loss only affects communication. So is it myth or fact?
Myth.
Yes, very good. It is myth. As we've already seen in the slides, it is affected our personal safety. It can lead to depression, and it can affect our mental health also. So it is not only affecting our communication, it is affecting overall well-being. Okay, next is hearing loss can happen at any age. It is myth or fact?
Fact.
Fact. Yes. It can happen at any age. It doesn't matter whether it is a child or a elder people. It can happen at any age. If it is a child, might be it is happening due to congenital, like during birth only. It will pass through mothers to their child, or it can happen because of age. So that's why it is a fact. So noise can't hurt me unless it is painful. So is it myth or fact?
Myth.
Myth.
Yes, it is myth. And why it is myth? Because most of the time we are using headphones, it is not creating one-time effect, but it will be discomfort in a long time run. Suppose somebody has a profession, they are wearing headphones, at least 8 to 9 are there on the phone calls, but yes, in future it can create hearing loss. That's why it is myth. Hearing aids deteriorate my hearing. So is it myth or it is fact?
It's a
Myth.
myth.
Yes, it is myth. Hearing aids cannot deteriorate your hearing. So a good hearing aid helps you to hear, and it can stabilize your hearing. It can stop your further deterioration also. That's why it is myth. So hearing aid is very important and very well prescribed by a certified audiologist. That's why a good treatment is very important. If you're not taking hearing aid to a certified audiologist, so definitely that can deteriorate your hearing. You cannot use the hearing aid that way. So you need to go to an audiologist, go check your hearing, whether you have loss or not, and you have any hearing loss, so definitely you should go to an that can be prescribed. Your hearing aid is only can prescribed by an audiologist, that is certified audiologist. So only one hearing aid is not sufficient. Is it myth or fact?
Fact.
Fact. Okay. Any other? Anyone else?
The myth.
It's a myth. So I'll tell you the reason. God has given us 2 ears. Why? There must be a reason, right? A 1 ear only can cover 180 degree. A both ear can cover a 360 degree. So both of the hearing aid will going to help you. One hearing aid is not sufficient. That's why it is fact. Okay. So surgery or medication will improve my hearing. Is it myth or fact?
Fact.
Fact. Okay. Any other? Anyone else? Okay. So it is myth. So it depends on your hearing problem. Only surgery or medication will be recommended, right? If you have, like I have already told you, you have a ear has 3 parts: external, middle, inner. If you have a problem in external or middle ear, then only you will go for surgery or medication. What about your inner ear? If you have your difficulty in inner ear, then only the treatment will be hearing aid. So the surgery or medication cannot improve your hearing. So that's why it is myth. Hearing aids have a poor sound quality and are uncomfortable to wear. Is it myth or fact?
Myth.
Myth.
Myth. Yes, it is myth. If your hearing aid is not prescribed, again, if you're taking the medicine through some uncertified person, then definitely there will be some consequences. And those are the consequences. A patient who has wearing the hearing aid and they're giving the feedback, yes, they have a poor sound quality and uncomfortable to hear. So ask them to change your hearing aid and change their audiologist, because your audiologist should be well certified. Then only you can take the better treatment, and the better treatment will be the hearing aid that should be well prescribed, and it depends on your hearing loss only they can prescribe you hearing aid. So that's why it is a myth. So
Rukmini asking, how can you prevent hearing loss?
So okay, I'll give the answer. So to prevent the hearing loss, you should just keep it in mind that you're not going to use the earbud inside your ear. Just keep it like low, loud. You should avoid the loud sound. Basically, that loud sound can create hearing loss in your future. So those are the things that I've already discussed. Avoid loud sound. Do not put any earbud. Do not put any oil or external object to your ear. Only through that you can prevent your hearing loss.
Can we wear our AirPods while listening to some music or anything?
You can wear, but just try to minimize the volume and do not use it for more than 1 hour or 2 hours. Just try to minimize the volume.
There's another question between earphones and a headphone. Which one is better?
Earphone and headphones. You can use headphones because that is over the pinna, so that doesn't cause you any ear pain or something and doesn't cause you any ear infection, so you can go for headphones. But just again, you should try to reduce the volume the same. No, there is another question, I think. Sensory neural hearing loss, any vitamin intake can help? No, it is a nerve weakness. We cannot stop our aging, right? So it's because your sensory neural hearing loss is mostly happen in the old age. You can see that. Okay. So we cannot make our age constant. That's why there is no any vitamin, there is no any medicines that can stop your hearing loss. So there is only one treatment, that is hearing aid for that.
Okay, there is a question which was sent to me, which says, like there are exercises for other parts of the body, but if we want to, with age, want to like just either maintain or strengthen our hearing health? What are the good to do's?
Sorry, your voice is breaking actually. Can you just repeat the question?
Yeah, I'll repeat. Am I audible now?
Yeah, you're audible.
So as we age, like how there is exercise for rest of the body, what is it one can do to maintain or improve hearing health on a daily basis?
No, ma'am, there is no any exercises to maintain our hearing capability or hearing ability. It just you need to avoid the loud sound. No need to put any external. Only those precautions you have to take. Otherwise, other than that, there is no any exercises. But this I have already told you. There are three parts: external, middle. If you have any blockage or some fullness is there, then you directly talk to your ENT doctor. They will help you on the medication. But there is no as such exercises that can help you to maintain your hearing abilities.
Okay, hope that answers. Daisy, do you want to unmute and ask your question so it is more clear?
Yeah. Doctor, good evening. Sometimes I feel like holding my nose just to open up my ears. Okay, and this happens quite often, even if I'm driving, high altitude. I always feel my ear is blocked, especially one ear.
Okay.
So, is that any reason for that?
There is some pressure difference. There is middle ear. So if the negative pressure builds up inside the middle ear, it will cause that blockage and that fullness. So what you need to do is just have to close your nose and just fully
blow through
like
the cheek.
I'm showing you. Yes. Blow up your cheeks, and that pressure will again come to the normal thing. So you can do that exercises. Other than that, to no.
Yeah, I do that, but on flights it's very difficult because if you try to open up,
it is very difficult.
It hurts a lot. The ears hurt a lot. So I wait till it subsides and then I try to blow it out.
Yeah, you can do that. This exercise in the flight also, so it will ease you there at least.
Okay. Thank you so much.
Question from Kanchana is, what are the medicines which have side effects of hearing loss?
There are some like soframycin. This is the mycin group of medicines has side effects. Okay, so you need to check with your doctor whether this medicine is really really helpful for you. Then only you take that medicine, and that mycin group of medicines only affects your hearing basically.
Okay, Kanchana, hope that answers your question.
Is there any like level of decibel level that we are not supposed to hear? Like one cannot measure the decibel level, but up to which point, like, should not it cause some hearing loss?
Basically, ma'am, this
how loud a sound should be for us to lose a hearing?
Okay. So if you're hearing the sound like 60, 70 decibel sound over 8 hours of like on a daily basis, then of course there will be some hearing loss detected in our later stages. So you just have to avoid a loud sound for a longer time period. If your work schedule is like that, you need to take that call, or you have to be on the phone call. What you need to do, you just have to turn on the speaker rather than to just use the phone like this. So you can just avoid those conditions.
Okay.
Are hearing aids advised even for a mild hearing loss people?
Yes, ma'am. For mild hearing loss, only we can, from mild to profound, we start prescribing the hearing aids. As I told you, early intervention is very important in any kind of disease or disorder. So if you start early, your results will be much better.
Any cleaning method for the blockage of the ear?
For blockage of the ear, no ma'am. If it is completely blocked by wax, then you need to go to an ENT. You can't clean it by yourself. If you clean it by yourself, might be you can damage your eardrum. So no need to clean it by yourself. You can directly go to an ENT doctor, they will do it themselves.
Okay, thank you, doctor.
Okay, I've received another question which says some of us use garlic in cotton when we have a ear block or a cold. Is that advisable?
No, that is not advisable. Otherwise, it can lead to infection. So please do not put any garlic or any mustard oil or any oil to your ear. It can lead to any infection, which is not advisable. So if you have any difficulty in like blockage or something, you directly go to doctor. They will only help you on the medicine. Like they will give you medicines so that it can be treatable.
Okay. And if someone's a healthy older adult, as they age, given that they have no concerns as such, is it advisable, like how you go for a regular dental checkup, right?
Yes.
Once every 6 months or so. So what is the frequency to check our hearing health as we age?
Every 6 months you need to go for a hearing test, has to be done, so that we can monitor whether any hearing loss is there or not, or how your hearing capabilities are, hearing sensitivities are. So every 6 months you need to go for a hearing test.
Another question, doctor, to that is, how much does a hearing test cost?
So it depends on your audiologist, like some of the clinic, whatever clinic is available at your nearby area. So few of the even hearing camp is also going on. So you can go there, they can do the testing there. So it will be free of cost if you're going to your nearby clinic. So I think it will be around 700 to 1,000 rupees cost.
Okay.
I just asked that, is tinnitus curable or how it is done?
Yes, ma'am, it is curable. But we need to see why tinnitus is there. Firstly, we need to verify, we need to detect what is the reason of tinnitus. There are multiple reasons for tinnitus. Major reason is hearing loss. If tinnitus is happening, like it's happening since 6 months, 7 months, so of course there will be a reason. So we need to rectify that reason. If that reason is hearing loss, so there are multiple options, like you can go for hearing aid, and there are hearing aids available which have tinnitus therapy itself. So we can minimize the tinnitus, and after using the hearing aids on a certain time, it will completely vanished.
Ma'am, what is the difference between ENT doctor and audiology? Like,
so ENT, yeah. So ENT doctor will take care of the disease or disorder, but audiologist will take care of the hearing part. So hearing part I've explained you, right? The ears have the structure. Hearing comes from ears to brain. Whole structure we will take care of that. So that's why, or this is the difference. Audiologist can prescribe you the hearing aid. ENT doctor cannot prescribe you the hearing aid. They don't know what is the treatment for the hearing loss. They will give you medicines and all, but there is no any benefit with the hearing aid. So if you have any disease or disorder, you will directly go to doctor. If you have middle ear infection, any discharge pain is there, you go to ENT doctor. But you have hearing loss, you have to come to audiologist. So this, in layman term, this is the difference between audiologist and ENT doctor.
Thank you.
Thank you,
Dr.
Chitra.
Isheeta.
Very informative.
Thank you. Thanks for attending.
Hi, Kala. Good.